G'day everyone, this is Health Highlights. Health Highlights is a show about health, health professionals and the people and the stories behind the names that we hear about but we seldom get to meet. Now, in life we express ourselves in all sorts of different ways. But one of the ways we love to express ourselves is through art. Now, lots of people love art. I know my kids, they love art. But art is actually therapy as well, and it can be used to really bring some well-being and health to many people's lives. So today, we're going to really dig into this very fascinating area of art therapy, and we have Michelle Sparrow and
Hi.
Karen O'Dell with us. How are you guys?
Yeah, good,
I'm
thank
good.
you, Simon.
Firstly, what is art therapy, and what's the tools that you use to help people get better?
So basically, art therapy is the process of making art becoming therapeutic. That can be done in many different ways using many different mediums. But yeah, it's basically, a lot of people make art and enjoy making art, but it's when you can take it a little bit further and that becomes therapeutic.
And so where did it originate from? So did it just sort of come about, or has someone actually formulated what art therapy is?
So it's probably been around since the beginning of time. When you look at people did cave paintings and made things by hand, and
Yeah.
but as the term art therapy goes, it's probably been around since about the 1930s and 40s.
Yep.
It started with people when they were returning from war. A lot of them were unable to express what they'd been through, and some of them were artists, and they were in mental health facilities, and they just started painting, and they realised that being able to paint, they could express what was happening inside them, and then it went further from there. The psychotherapists started working with them, and they would bring things out of their paintings that helped in their healing process, and
That's wonderful.
the art therapy term was formulated, I guess.
Yeah. And so what are some of the tools, I suppose, that you as art therapists have in your hands that you can use to actually bring out this therapy?
A lot of it is about relationship within it. So you can do art therapy in different settings, as a one-on-one or in a group. And so in a group, it's about a group relationship. We'll use tools like all sorts of art mediums, paint and crayons and pencils and pens, and we'll have some clay, those kind of tactile things. And a lot of it is about the relationship that's formed in the group, and then that helps to bring things out.
Awesome.
Yeah.
So, I mean, it's an interesting profession. How do you actually get involved, and how did you guys particularly get involved in becoming art therapists?
Well, Karen and I have been friends for a long time, but we actually, I was living overseas in America, and Karen here, and we both got into it at the same time.
Right.
Which is exciting. So mine really originated from teaching, Simon, school teaching for about 18 years in art, and lots of art classes. And when offering the art classes here from home, I saw the benefit of it for so many kids.
Yeah, right.
And then in America, I actually got the opportunity to go into hospitals and actually work with people in the hospitals there, both on the wards and in the behavioural unit, and I just loved it. I loved it, and I saw the power of healing through art, which was great.
Awesome.
Yeah.
And how did you get involved, Karen? What was the catalyst to actually become an art therapist?
Needing a career change.
Yep.
Midlife crisis, whatever you want to call it, But the first time I ever saw it in action was in a women's refuge, and each of the women in the refuge had their own visual diary, and they worked on that every few days, and that was a huge part of their healing. And I just thought, this is amazing. I'm an artist, I love art, and I love that it can help people heal, and I love people.
So good, absolutely.
So put the two together, and there's a new career.
It's a great marriage, isn't it?
That's great.
Yeah.
So now, I'm sure you get this question often, but do I need to be a Michelangelo to actually do art therapy?
No, you don't.
Okay,
Simon.
well, that's good.
No, no. This is a question that we're asked a lot as art therapists, and basically, an art class can be skill based, whereas art therapy is about the process.
Right.
It's about the process of creating an art piece. So if you're using collage, magazine materials, Words are sometimes used as well as imagery. But yeah, you can have no art background and really experience the benefit of art therapy coming in for the first time.
And so, and I suppose that leads us to what actually is the benefit that people are experiencing, and how do they get to that benefit? Like, is it just the process of expressing their emotions, or is it also this therapy that you guys are providing for them as well that actually helps them on that journey? Can you sort of talk into that? Yeah.
Yeah, most people, when they come for an art therapy session, we will tailor the session to them.
Yeah.
So we will ask them, what is it that you'd love to do? Is it art as therapy for your own enjoyment? Or is it an expression? Is it an expression of your emotional world? And we call it the subconscious, all our thoughts, all our reasoning, all our emotions that we feel in life. We tailor sessions to be able to bring that out in people.
Awesome.
So the benefits would be health and well-being, stress management. Art therapy can be taken into the workplace as well.
Yep.
And dealing with different sides of work life. A lot of people are off from work on stress leave.
Yep.
So it's about treating, if you like, or bringing a complementary therapy to actually take out what is happening in the head and what cannot always be spoken and verbalised, and putting it out onto something as simple as a piece of clay.
Yeah, right.
And so kids can benefit from this, adolescents can benefit from this, all ages. So the benefits are wide.
And so I suppose that leads to the next sort of question is, okay, so as an art therapist, are you using the art as actually an indicator of where they are emotionally, or is the art really, and the process of that, actually the healing process that they're going through, or is it sort of a bit of both? So what would you say as art therapists? What are you sort of, what's in your head when it comes to that client?
Yeah, so again, it depends on the client as well, and what state they come to you in. So it can be both. For some people, it's just as simple as finding something to bring them enjoyment, and a lot of people will go and do a yoga class. Not everyone can do that, but some people can find a love of art and creating, and that will be enough to just give them some enjoyment. But for other people, they will produce artwork that will sometimes quite clearly show that what's happening in their mental state, but at other times it can be then a series of questions as you talk about the artwork. So in a setting like this, say the artwork becomes the third person.
Yes.
I guess so.
Right.
So it's less confronting for people, and you talk about the artwork actually, not talking about yourself.
Yeah. And that really helps them, I could imagine, disconnect from their emotions, but then still see them.
Yeah.
So obviously you're trained in some form of psychology and helping them through those processes.
That's a big part of the training that I've done, and I will be doing a lot more of that.
Wonderful. Yeah, that's
a lot
really
more
good.
reading.
Okay, so when it comes to mindfulness, Michelle, so there's a thing about mindfulness and the role that mindfulness has around the therapeutic intervention. Can you just sort of share with us a little bit of what that looks like?
Mindfulness, Simon, is a huge buzzword right now.
It is.
Whether it be in the health field or, for me also, in the education field, working with kids for many years. Mindfulness is about being present in the moment. It can be a form of meditation, like the yoga, like breathing exercises, but the art is a focus at that point in the moment. If you like, it's a creative distraction. And so many of the times we're transitioning, we live in a busy age, and so it's being present with that artwork, whether it's a piece of clay, whether it's a painting, a drawing, it might be just free lines. It's actually focusing on what is happening in that artwork at that time and leaving all the other things out of your world for that moment. And that can range for lengths of time. As art therapists, we can lead people through guided art therapy experiences. So if people are not able to practice that mindfulness, being present in the moment, And through a lot of traumatic situations, that's actually quite a painful process, no matter what age. And so as art therapists, we can take people through that guided practice.
Awesome.
And some of it does. I know I have used breathing exercises and other things in the art therapy session to bring people into that moment and into that time. So it's a beautiful creative distraction. And mindfulness is using all the 5 senses: tactile, the smells, the sounds, what's happening in your environment, and putting it down if it's on paper, clay, sometimes knitted materials we use as well. So,
and I could imagine when people are stressed that they're not as creative, but if you settle down their sympathetics and allow them just to be in the moment, suddenly their creativity, is that the case with the world? Yeah,
that's true, Simon. Yeah. The stress and the always thinking about the next. It's always it being present in this day and age is one of the greatest things that we could do, not only for ourselves, for our families,
absolutely,
and the workplace situations that we find ourselves in. So, practicing mindfulness, even if it is just some little drawing. There's Zentangles. There's thousands of different booklets you could just use in your own home.
That's right.
You can practice art as therapy, but you will get, science has showed that you will actually get greater impact in the workplace, greater impact in your home environment if you can lower those stress levels, and art is a great way.
Absolutely, that is awesome.
Yeah.
And so, Karen, who can benefit? Like, is it for everybody, or who are the major people that you're seeing?
Well, I've just recently done a 6-week course for artist therapy for mums. Just a simple program for mums to take some time out for themselves. That's how it started. Out of that, we had people who were safe enough in that place to let us know that they've been going through some pretty serious things, and then create artworks to help them through that healing process. So yeah, it can benefit anybody. It's a great thing for people suffering from depression and anxiety, to just give them some tools to help with that.
Absolutely.
And to be like a supplementary therapy for psychologists and psychiatrists, and for people who are needing to go deeper with the issues that they have. So yeah, it can benefit.
That's great.
The benefits, like what Karen was saying, it's sometimes it will be an individual session, but a lot of the times it will be an ongoing, might be a group session.
Yep.
There are individual sessions you can have. And a lot of people and charity groups actually bringing these things out into the community. Mindfulness Mondays, working with employees, working in park environments, taking art out, especially if you have chronic pain. For you to be able to actually leave the home is such a big thing. And so just being mindful again of the environment around you, and also the discussion that comes out of these groups. That is where the therapy happens. It's about the process of creating the work with what you have, but then it's articulating what's actually happening through your artwork. And it does become that third entity, that third person, as Karen said.
And so I suppose the last question is, so how does a normal session work? Like, what does that look like in terms of, do you come in, how would you say a normal session looks like?
It probably works fairly similar whether it's a group or an individual. But say for a group session, you come in, you would all mingle, get to know each other a little bit if that's the case, or you just sit down. We'll start with a prepared, so for an example, I'll have photo cards. Can put photo cards out, people will look at the photo cards and just pick something that resonates with them for whatever reason, and then we'll have some discussion around why they've picked that picture, and then they'll work out a response to that. So they might do a painting. So we did one recently last week where one of the girls did a painting, another one did a work with clay.
Yep.
And then when you produce the artwork through that, and then we have some more discussion at the end of it about that artwork.
Wow.
And that can then lead into another, depending on what comes up. that can lead into another artwork. Yeah.
Sounds great. Wonderful.
Sometimes, Simon, with children and adolescents as well, particularly with young children. That's really one of my focus areas, coming out of a art teaching background. But we can also use the role of play therapy.
Yeah, right.
And so not always just using the art, but actually watching the children interact with toys, with figurines, role playing, life transitions, things in their world that sometimes they find quite painful and do not know how to articulate.
Yep.
Other times it might be a drawing session, and one particular student I was working with, or a client, a child client, we sort of began to ask questions at the start. What interests you? What do you love to... He loved drawing, so that was great. But not every child will come in with that, not every person. And he particularly loved the ocean. And so I'm actually holding one of his clay artworks. Here we've got a little treasure chest, and it's all the interest of what lies beneath the ocean. Also pirate ships. And so we try and tailor the art therapy sessions, if it's individually or if it's group, to actually really suit their loves, the things they are passionate about.
Awesome.
And some of that will also incorporate walking through some of the pain, and then being able to articulate what is happening at that time for them.
Wonderful, wonderful.
Yeah.
Well, look, thank you guys. It's been amazing to hear a little bit about art therapy. No, our pleasure. And thank you everyone for joining us. I'm sure you found that absolutely fascinating to dig a little bit deeper. And if you've got some people that you know that might benefit from some art therapy, either some kids or some adults, look, Michelle and Karen's information is going to be on the screen for you right now. I'm sure they'd love to hear from you and support you through that journey of wherever you're at. Look, thank you again, guys.
Thanks.
Have a fabulous week. We'll see you the same time next week. Remember, healing is a gift, health a responsibility. See you later.
Bye.